So definitely we are here for the evolution, supporting the evolution rather, as I have already mentioned initially. Now it is an era for definitely a joint replacement is there for a very damaged knee. But with the so many DMODs and different options, regenerative science is always a good option, and till now we are not able to reach to any consensus. And I think osteoarthritis is the most complex situation. It's different from the rheumatoid arthritis because of a different mechanism. For understanding the cellular therapy requirement, we need to see what is the current scenario, what we want to address actually, and how we can go ahead regarding this. So definitely, osteoarthritis. There's so many causes. It was very wonderfully discussed this evening. But the most important, I'm just taking it with the laxity, with the age degeneration, and the laxity of the surrounding muscles. So it has already been discussed beautifully that how the fibrillation and the degeneration start, and we have to take a call at that particular time if we are not going to go for a arthroplasty. And definitely osteoarthritis has got a bumpy road. So many times the people are coming to us, coming to everybody, and they get resolved at early stage, and then they again have a bumpy road and they again come back to a different orthopedic surgeon. Cellular therapy is a answer, may reverse the arthritis, but to a certain extent only. So definitely that extent we all can understand. That is the grade 1 to early stages of arthritis, which was again very well explained this evening. So, what are the difficulties which we require to find out an answer for the cellular therapy? So, it is like a surgical intervention which is not appropriate. A borderline case as a patient who is coming to us with a grade 2 early arthritis, which is going to progress, not responding to the conventional management. Of course, it has to be very well taken care of. It is osteoarthritis. We are not entering into the CPPD type of a picture, which is again a mixed picture, which we have to identify as orthopedic surgeon so as to make a clear-cut diagnosis. And in India, we are again approximately 16,000 orthopedic surgeon. So you can see and we can estimate how much complex this diagnosis is being made by us most of the time, which is not a osteoarthritis, and we think it is as a osteoarthritis. So definitely when the patient is of young age and a long duration is being seen, and we know that it is osteoarthritis and patient is not able to be managed by other disease modifying osteoarthritic drug, then definitely this is a choice. Now we are discussing since evening about the cartilage regeneration and ultimately what the patient want from us. And what the patient want from us is definitely at that particular time the anti-inflammatory, the pain-killing effect without any, NSAIDs and all the things, which is now a past thing actually. For moving this, definitely the cartilage repair, which has been evolved for the last 2 decades, is microstimulation. I'm not going to detail. Autologous chondrocyte implantation, we all know this thing. And latest is oats, but again, it has got certain disadvantages sometimes, as it has been seen that the long-lasting result in some cases has not been there. So for this, later on, the addition of the MNC cocktail or mesenchymal stem cell would give a better result. Now, we have already seen at different forums about what are the stem cells, but just to make it very short, we are discussing as an orthopedic surgeon the mesenchymal stem cells, which are present at all the places in the body, at each and every tissue in the body. And the tissue discussing this evening is the knee, the articular cartilage, the subchondral bone, which we are discussing since evening, that how the changes are been there, what we can do for the articular cartilage, what we can do for the subchondral bone, so as to minimize this thing to go in. So these locations are having a progenitor cells. The progenitor cells can be classified again into hematopoietic and mesenchymal, which we are discussing this evening. Now the different modalities of the cellular therapy which are there in the clinical trials across the globe are PRP, bone marrow cocktail, that is the bone marrow being aspirated out, centrifuge, and the cocktail is being ready, and the mesenchymal stem cell, which is again a questionable, as with the ICMR guidelines, it is a cultured cell, so it should not be used unless until the clinical trials are being done. So need to understand why and when should be used. There are so many supportive literature if you Google around it, the mesenchymal stem cells or the BMAC or the PRP with or without hyaluronic acid. But definitely from India, we don't have so much work till now, but definitely the clinical trials which are moving across the globe, there are so many of them. I'm so sorry for the busy slide, but definitely only one clinical trial is being done in our country till date with a giving of a commercial product for the mesenchymal stem cell. However, the Japan, this Food and Drug Administration from the Korea, they are into the market since 2012 with the mesenchymal stem cells. But in our country, only last year we are able to come out. But again, it has been FDA approved, and it is again a conflict of a work between the ICMR and different things which should not be commented at this juncture. But as an orthopedic surgeon, I think in the coming 3-4 slides, all the answers will be there that what we can do for the knee and what our forefathers, our professors, our seniors used to do when there was nothing available for the osteoarthritis. We are discussing for this is only for the mild to moderate cases, definitely not for the severe cases. Now, after skeletal maturity, we all know that articular cartilage stop proliferating and is slow to replace as well. The reason behind is number one, the lack of blood supply. Number two, the chondrocyte which are there, they are actually very less mobile because it is in the matrix, which is very dense, and the limited number of the progenitor cells. So they are the three things which needed to be addressed for managing any mild to moderate osteoarthritic cases. Definitely, we know that there is apoptosis, there is eating up of chondrocytes with the age. Everything's advances, everything goes away with the age. So the chondrocytes also goes away with the age. So we need to replace them. So definitely a balance of the chondrocyte to maintain the matrix between the synthesis and degradation is being disturbed, and that is why the patient is coming to us. So by now we are very much clear whatever we want to do, we have to do only at the cartilage level because the next would be the subchondral bone which is to be involved. That means the cartilage is being involved first, then the subchondral bone at the most of the time. Now, active chondrocyte, how we can have these active chondrocyte at the place? Definitely by having all those chondroprogenitor cells which are there in the chondrocytes to become active. How they can become active? Of course, one answer would be a walking, which I'll going to stress later on. Second answer is definitely the cellular therapy. That means platelet-rich plasma or the mesenchymal stem cells or the commonly which called as the MNC cocktail in early mild to moderate cases depending upon the severity. Now, active chondrocyte means the chondrocytes which can proliferate. If they can proliferate, they will do their job. They will repair it beautifully well. They will make it very healthy. So one answer is by cellular therapy. That means the mesenchymal stem cell or PRP or MNC, and we are not able to discuss much in detail because we are just touching these topics here this evening. But definitely this is a different answer. But as the trials are not being done, so definitely we are not in a commanding phase. But definitely yes, we all orthopedic surgeons know that these growth factors which are being secreted by the platelet, which are being secreted by the mesenchymal stem cell, which are being secreted by the hematopoietic stem cells or the monocyte or any damn cells there, they have a aim to repair the things very well, and the repairing is what? The proliferation of the chondrocyte, the multiplication of the chondrocyte, that's so that they can become a healthy. So we all know, I think this is again touched, that the mesenchymal stem cells are there in the synovial fluid. In the lecture today, we have a discussion that synovicytes, they produce the synovial fluid. But what is a synovicyte? Synovicytes are nothing but these are the mesenchymal stem cells, which are present hooks and places, different places of the body. Now, exercises by the brisk walking means simply the stimulation of a chondrogenic potential of the cartilage or the stimulation of the progenitor cells or the stimulation of the mesenchymal stem cells or the stimulation of the synovicytes or the stimulation of the progenitor cells to proliferate. That means a brisk walking only in the mild to moderate stage where there is no mechanical derangement, where there's no other pathology. In that case it is going to work, and that is the reason our professors, old professors, our teachers, and the yoga and all the things, if you correlate this thing in the cycle form, all the answers will be there. But again, lack of the evidence, as we are into the evidence based medicine. So take home messages would be PRP in early osteoarthritis may be useful for early osteoarthritic knee in a given situation. Mesenchymal stem cells may be of use for mild to moderate condition because they decrease their inflammatory cytokines which we want. They are basically the analgesic bullets inside the knees, and that is why with the brisk walking, as the endorphin has been increased, it has been estimated that the thickness of the cartilage also is being increased, and it has been very well reported in the medical fraternity with the medical science now. And definitely, what the result we are getting from any damn cellular therapy is the paracrine effect. Here are the few references. Thank you so much.